It was 13 days ago that we announced our first 4 positive COVID-19 cases in the state of Montana. Today that number is at 90. In so many ways, our state and our nation is a heck of a lot different than it was 13 days ago. As I've said before, there are concepts that we are rapidly introducing during this pandemic that were certainly foreign to us just weeks ago. There's a lot about this particular disease that is presenting really enhanced challenges. The virus may live on surfaces for an unknown period of time and remain in the air for some time after someone coughs or sneezes, creating a range of opportunities for exposure. Exposure may also happen when a person touches the surface or object that has the live virus on it that touches one's face. There are things that we do know that can make a difference. Pandemics aren't without precedent even here in Montana. Neither are the measures necessary to stop the spread of communicable disease and respond to the emergency. During the Spanish influenza outbreak of 1918, public health authorities closed schools and other public places all across our state. These measures can save lives across the United States even now. We know that for every person who stays at home and avoids large crowds, the better our chances to fight this virus and protect our frontline healthcare workers and our emergency responders. Staying home if you can. No gathering. Staying 6 feet apart from others when you can. Planning ahead to limit your contact with others. These steps will slow the spread of the virus. And ultimately, these steps will save lives. There is no doubt that COVID-19 is causing a lot of hardship for small and larger businesses, workers, and the unemployed, for the grandchildren unable to visit their grandparents in the nursing home and even cautious about visiting them in their own homes, for parents working from home while helping their kids continue to receive a quality education. It's also causing incredible hardships for our frontline doctors, nurses, and other hospital staff across the country. I recognize through all of this that Montanans have always had an independent spirit. Yet at the same time, we've never shied away from looking out for our neighbors. We've always made sacrifices for the overall good of our communities. While the times ahead will not necessarily be easy, Montanans have always pulled together in times of challenge and times of crisis. This is what keeps me, and I know so many others, inspired and optimistic that we'll actually come out stronger from this. But with 90 cases in our state today, in counties reaching from Lincoln in the northwest to Roosevelt in the northeast, and with 38 cases alone in Gallatin County, we have to do more to curtail the spread of this virus. In other states, hospitals are overwhelmed, and healthcare workers are getting sick themselves. I don't want that to become Montana. It's critical that we do everything that we can to cut off the chain of transmission and also make sure as we flatten this curve to buy time for our healthcare workers on the front lines so that they won't have to make what are almost impossible choices in the coming weeks. In consultation with public health experts, healthcare providers, and emergency management professionals, I've determined that to protect public health and human safety, it's essential to the maximum extent possible that individuals stay at home or at their place of residence. So beginning 12:01 a.m. on Saturday, March 28th, we'll be implementing immediate measures to ensure social distancing by Montanans staying at home except for essential activities and services. Such an approach will reduce the overall number of infections in our state, and it will preserve our healthcare resources. Under these measures, Montanans may leave their homes for essential activities, including for health and safety, for necessary supplies and services, for certain types of work, and to take care of others. Additionally, Montanans may leave their homes for outdoor activity, as long as they comply with social distancing requirements. We really are so lucky to live in a state where we have ample opportunities to access our public lands that remain open to recreation. But I'd urge Montanans to use good judgment if a trailhead seems too crowded, and then just find another access point. My administration's been working many hours working with public health experts to ensure this takes the most practical, what we're directing today, the most practical and the most needed steps to slow the spread of this pandemic. So to determine which businesses and workers are exempt from the order and should continue working, we're following guidelines largely developed by the federal government. The Department of Homeland Security put out something on March 19th talking about essential workers and essential businesses. Then the directive, and I apologize for those on the call and here that we didn't get that out in advance, it spells out a bit more within the directive of listing a more comprehensive list of what is viewed as the essential business activities that will stay open. If an employer has a question about where the industry falls, well, I think this is a pretty comprehensive list. First, do consult the directive and the federal guidelines. Still, though, if an employer has questions, we've set up a 1-800 number that you can call, leave a message, certainly at any time of the day or night. We'll provide as prompt a response as possible. That number is 1-800-755-6672. 1-800-755-6672. But I'd encourage you first to actually look at the directive and look at the federal guidelines as well. I'm taking these measures today because we need to stay in front of this pandemic and slow the growth of infections so that our healthcare system is not overwhelmed. It's our frontline doctors and nurses and taking care of our friends and neighbors. And I'd rather be accused of overreacting than have a healthcare system overwhelmed and unable to help our most at-risk Montanans when they need it the most. I'd rather our doctors and our nurses and our healthcare professionals know that Montanans from all across our state have their backs and are doing our part to lessen their burdens. I'd rather keep as many people healthy as possible. After all, in order to have a healthy economy, we need to have a healthy population. We can't rebuild our economic strength without doing everything that we can to flatten the curve now and to slow the spread. This crisis requires all Montanans collectively to do their individual part to slow the number of COVID-19 infections. The individual actions that we take now will protect more of our friends, family, and neighbors from this dangerous infection. At the same time that Montanans stay at home, know that the state level will continue to do everything, and at the local level, to mitigate both the health and economic hardships. We continue to look into additional protections for consumers. We continue to look for every avenue available to expand testing capacity in our hospital supplies. And we really are, all of us, in this together. And we can get out in front of this together. And when the time comes, again, we will be rebuilding that much stronger of community again together.